Black Doctors podcast highlights the stories of minority professionals with the goal of inspiring others. If you like what you hear, please subscribe and share with others, because the next generation can't be what they don't see. Tune in every Monday to hear our stories told by us.
Hello and welcome back to the Black Doctors podcast. We're closing out Women's History Month with somebody that's extremely special, near and dear to me. It's Dr. Linda Suleiman. She is an assistant professor of orthopedic surgery at Northwestern Feinberg School of Medicine. She's also the assistant dean of medical education and the director of diversity and inclusion for graduate medical education. Dr. Suleiman, thank you so much for joining us.
Thank you for having me. I've known you so long. It just feels good to catch up again.
It's been a while since our Howard University College of Medicine days.
Yes, followed by the Chicago residency days.
Yeah, for sure. So let's start by telling us about a typical day in the life for you. You finished residency at Northwestern and then did fellowship before coming back. So tell us about a typical day for you.
So for me, I spend 4 days clinically and 1 day administrative. And so I typically am in clinic 2 days a week, seeing patients in the office, and 2 days a week I'm in the operating room. And then just depending on what's kind of going on, I'll either take 1 or 2 research admin days versus 1 day a week. But it's I always make sure to protect at least 1 day a week to getting my administrative work done, as well as some of my research.
And in the clinic, you're seeing new patients, follow-ups?
Yeah, so in the clinic, I'm seeing new patients with hip and knee complaints. Typically, I see an older population since I specialize in joint replacements, mainly dealing with arthritis of the hip and knee and any kind of reconstructive procedures that are needed. And I'm still typically seeing new patients, my post-ops, second opinions in my clinic days.
Then when you get to the OR, how many cases a day are you doing?
So typically I'm doing anywhere between 3 and 6 cases a day. And then it also just depends whether I'm on call or not. I still take trauma call. So any orthopedic trauma that comes into the hospital.
And then what percentage of your practice is joint replacements versus hip replacements, and what else do you do?
So I'm only doing hip and knee replacements or revision surgeries, meaning I'm redoing a prior joint replacement for either infection or component failure or implant failure. And then I only do trauma when I'm on call, but typically hip and knee specialist.
Gotcha. And so what does your call look like?
Yeah, so we're in a pretty big group. So we typically take 1 night of call a month, and then about 4 to 5 weekends a year. So it's really not too bad.
And when you're on call, you just take whatever comes in the door?
Yeah, when we're on call, we take in whatever orthopedic trauma, hip fractures that come in. And then during the week, we kind of pass it off to each other. So, if I was on call and something about an ankle fracture comes in, that typically my ankle partner would take it. Versus if he was on call, he or she was on call, and the hip fracture came in, I typically would take care of that.
Gotcha. So that's a huge clinical load, but you balance that with your administrative duties, which I imagine are a lot, as well as the assistant dean of medical education and the director of diversity and inclusion. What are your responsibilities as the assistant dean for medical education? So
my role is specifically within graduate medical education. So I'm in charge of, 1, recruitment and retention of our underrepresented medicine residents and fellows, but then also educating our entire residents and fellows on bias, as well as cultural competency, health equity, health disparities, to better take care of our patients.
And who helps you in that role of disseminating this information?
So we have an entire team. There's probably 6 of us that have a diversity role within graduate medical education and undergraduate medical education. So we do a lot of collaboration within the medical school and GME. And then we have program managers, we have staff who help with this. But all together, there's a pretty fantastic team that we have. And we just hired an assistant director of diversity and inclusion who is a prior fellow here at Northwestern, who's going to be coming on as faculty member in urogynecology.
I know at every SNMA conference, Northwestern always has a huge booth.
Well, SNMA is near and dear to me, so I'm happy to be a lifetime member of the organization and anything that we can do to support the group.
So, Dr. Suleiman, obviously, we know orthopedic surgery is a very competitive field to get into. I remember you back at Howard because you had your squad. You guys were always studying together. You, Danny, Adrian. There some good times. What did you do to set yourself up to match into orthopedic surgery?
Yeah, I think what I tell most students is I was exposed early. So I was lucky enough to have exposure to orthopedics as a first year med student. And, Dr. Bonnie Mason to this day has been a lifelong mentor to me. She's the one who introduced me to orthopedics. I did a summer internship through Nth Dimensions, which I believe if you're interested in orthopedics, you need to be connected with Nth Dimensions. It's a resources of mentors, research opportunities, and even as a resident. But being able to make connections early, not just from a research perspective, but identifying mentors who get to know you, and so that when you get to your sub-I, sub-Is are really important in orthopedics. So most students will do several, 1 to 3 away rotations in orthopedics, and majority usually match in where they rotated. So really having people in your corner to guide you in how to be successful to become an orthopedic surgeon.
How many sub-Is did you do?
I did a home rotation, and then I did 2 away rotations. So 3 total orthopedic rotations my 4th year.
Wow. And then obviously board scores are a huge component of your application.
It is, but step 1's going away in about a year from now. It's going to be pass fail. So I'm interested to see where people are going to put more emphasis. I don't know whether it's the 3rd year clerkships. Are they going to put more emphasis on step 2? Research. I think every program is going to have to decide for themselves what's important for them in identifying, a future successful orthopedic surgeon.
Yeah. And when it came down to, we just passed through the match process for this year, but when it came down to looking at programs, how did you decide which programs to apply to and which programs were high up on your list?
So for me at the time, I was looking to be in a city. I wanted to take care of patients who were in a more urban setting. So I applied mainly East Coast. I applied in Chicago, a couple California programs. But, it was a different time. It was 10 years ago when I applied for residency. But I was looking for an academic program. I know I wanted to stay in academics long term. And I was interested in research as a med student, but I really wanted to see kind of a bigger research infrastructure and how that kind of would run. So I looked at more of the bigger, more academic programs. That's where I rotated at least and ended up finding the right fit for me. But I also wanted to find mentors, one who looked like me, which is few and far in between in academic orthopedics. And I wanted to find mentors who did not look like me, who were invested in seeing me succeed in becoming an academic orthopedic surgeon.
And when you settled on Northwestern, you were if I recall correctly, the first African-American woman that they had as part of their orthopedic surgery residency program?
Yeah, and I knew going in, there's several Black women who applied this year and who've matched into programs that they're going to be the first Black woman. There's just so few of us. Black women in orthopedics make up 0.4% of orthopedic surgeons. So I knew the majority of places, the majority of orthopedic programs have never trained a Black woman. So what I was looking for was a program that not necessarily had trained other Black women, because I knew that would have been an even smaller pool of programs, but I was willing to be the first as long as I had that community and I had that mentorship.
Wow. And then, there's the stereotype. Every specialty has their own kind of stereotypes, but orthopedic surgery is regarded as the boys' club, if you will. So with that, how did you experience any challenging situations during residency, and how did you get through?
I was lucky enough that I did not personally experience that from my faculty or co-residents. I honestly felt it from other consulting services more so, and I felt it more so from nursing and sometimes even patients. And I still, to this day, I have patients who walk into my clinic and ask me, "Are you the one doing the surgery? And you came to my clinic?"
But you're on the website.
Right. They can look at me, they see my name, they come to my clinic, and I still get asked, "Well, are you the one doing the surgery?" So it doesn't cease to amaze me. The number of times I still, several years into practice, I'm still the one. Yes, I'm the surgeon, but they just don't see enough of us. And the perception is that it's a 6'5", white male who's going to be your typical orthopedic surgeon. And I don't think that's the mold anymore. And I think the whole boys club is not going to be there for too much longer. I think even this year at our match, nationally, things I saw on Twitter, there are more Black women who just matched into orthopedics this year than there are Black female orthopedic residents currently in residency.
Wow.
So we're making leaps and bounds, and it's nice to see that the efforts we're making in diversity and inclusion are coming to fruition.
Yeah, that's very exciting and I'm sure very rewarding for all the work that you've put into it. So, Dr. Suleiman, just about 18 months ago, you gave birth to a beautiful baby girl. I think a lot of the things that people worry about, especially women going into medicine and surgical specialties, worry about balancing the time between their practice and having children, raising children, having a family. How did you navigate that?
Yeah, I think my situation was probably on the extreme side. I delivered early. I delivered at 26 weeks due to preeclampsia, and I was in the middle of my board collection where you collect cases. So it was high stress time, and my daughter spent 3 months in the NICU. And so I ended up going back to practicing a month after I delivered to finish my board collection. And then I took my maternity leave when she got home from the hospital. But, there's no way I would have made it through all of that without good partners who saw my patients. They lightened my caseload for me. They saw my post-op patients, and they just said, you take care of yourself and you take care of your family, and this will all be here when you get back. And a lot of people don't have that type of support, and I was lucky enough to have that because it was probably one of the scariest times I've experienced. But with good people to work with and good colleagues, you make it through on the other side.
It's definitely true. Is there a good time or a better time to have children during the process of medical school, residency, practice, in your opinion?
No, there's never going to be a good time. You're either taking time away from your training or you're taking time away from your practice. I got married when I was at the end of my 4th year residency, and I wanted to wait till I wasn't attending, but that was my own personal choice where I had a little bit more control of my time. And actually I got more maternity leave as a faculty member than I would have as a resident. And, surgery is always going to be there. Training is always going to be there. Your practice is always going to be there. So there's never going to be a good time. You just got to make it, if it's something important to you, things will fall into place.
So Dr. Suleiman, in addition to all the things you've accomplished thus far, I saw you recently on Northwestern's website because you performed the first robotic total joint replacement. Is that correct? At that institution?
Total knee replacement. Mm-hmm.
Yeah, tell us about that. How was it?
Yeah, it was exciting. Being able to bring new technology to our patients at Northwestern Memorial Hospital, and it's I always wanted to learn robotics when I was a resident, but didn't have that opportunity. We didn't have a robot. And when I went to my chairman, over a year ago to say, I want to be doing robotic knee replacements here, he was just very supportive on making it happen. And I think it's been a great educational tool, and it's been great for our patients as far as recovery.
Yeah. So what's the process for picking up a new skill as an attending physician? So
I did some robotic and navigation as a fellowship, in my fellowship. So I did have skills prior, but then I recertified my robotic certification as an attending. And what I did was I went to other places that were doing robotics at high volumes, and mentors of mine, and learning from them. And I was lucky enough that one of my mentors came during my first day doing robotics to be there and to support me. And it's been great since. Yeah,
I know as a medical student, I didn't realize that as an attending, you could still learn new stuff. I know I still learn new stuff a couple years out. Learning never stops.
It never stops. Never stops.
In addition to all the stuff you're doing, congratulations. I saw the list that was recently put out. The National Minority Quality Forum announced their list of the 2021 40 Under 40 Leaders in Minority Health Award recipients. and was so thrilled to see your name on the list as well as your husband's name.
Yeah, it was really nice to see that. There's the National Minority Quality Forum has had a legacy of recognizing really leaders in minority health, and it's just such an honor to be among our colleagues who I look up to in this field.
And when it comes to minority health and the patients and the patient population that you see, what are some of the healthcare disparities that you've noticed within your patient population?
Yeah, so within joint replacements, we find that Black and brown patients are less likely to utilize a joint replacement. They're less likely to be referred to an orthopedic surgeon. They present with worse radiographs as far as the severity of their arthritis. And then when we look at their functional disability, their scores are a lot lower. So they're more debilitated and still not being offered a joint replacement. I think, there's many facets to that, but I think one of the main players is that we're a specialty that's just not diverse. And so I would say 65% of my patient population are African American. And I have patients who drive from St. Louis, Indiana, Wisconsin, Michigan, just to see a surgeon of color to do their joint replacement. And so we need more of us. Our patients shouldn't have to wait. We need to create the access to increasing functional rehabilitation. And I think there's just not been a lot of focus on disparities in musculoskeletal care, to be honest. I think it's never been a focus nationally. But you in order to work, in order to support your family, in order to be heart healthy, in order to control your diabetes, you got to move and be functional and be able to walk. And we forget about that aspect.
So Dr. Suleiman, as a first generation Somalian American, how proud are your parents of you?
I wouldn't be here without them. My parents, picked up and left everything behind when the Civil War started, and they have been nothing but supportive and reinforcing that, education is key. And even though we didn't have very much, they did everything they can and still do to create those opportunities for me and my siblings. So I just hope to make them proud, and the values they've instilled in helping our community, I think, still ring strongly in my day-to-day.
Yeah, it's awesome. And definitely looking back, having had the privilege to know you for quite a few years, you've always been someone I've looked up to because you always had a vision in my mind. Like, you always knew where you wanted to be, and you wanted to accomplish this goal of getting into this incredibly challenging specialty, and then being able to work with you or at least know you in Chicago and see all the progressions you've made in your field. Just incredible. I'm a fan. Keep up the hard work.
I appreciate you. I've had great colleagues to share in this journey with.
Yes. So for folks that are interested in pursuing the field of orthopedic surgery, what advice would you have for them, over the next couple of years as they're setting up their applications, or they may be in medical school or considering this field?
Many people will tell you orthopedics is too hard, it's too competitive, and it's not for you. The biggest advice I have is never let anybody tell you cannot be an orthopedic surgeon. Our community needs people of color. Our community needs women, female surgeons. So the biggest advice I have is, work every day on that path to making yourself the best applicant, whether it's studying for your boards, whether it's your clinical grades. And it's not just about working hard only on an orthopedics rotation, but just come out being a great physician. And that's what's going to make you a great surgeon. Stay hungry is what I tell students.
Awesome. Thank you so much for joining us. Where can folks kind of keep track of your progress? Are you, I know you're on Twitter, but where else can we see all the things you're up to?
I'm mainly on Twitter, and I have an Instagram as well.
And what's your Twitter handle?
My Twitter handle is Linda Suleiman, MD. And my Instagram is Linda Sules, SULES.
Well, we'll definitely be keeping an eye on you and seeing all the amazing things that you're going to do in the next couple of years.
Awesome. Well, thank you for having me.
The Black Doctors Podcast is a nonprofit, volunteer passion project with the goal of inspiring all who listen. Tune in next week for another episode of the Black Doctors Podcast with Dr. Stephen Bradley, your friendly neighborhood anesthesiologist.